It sounds like you've been going deeper into this after this discovery, but it also sounds like other people have been focusing on this for a while and other cultures as well. Can you
Yeah.
talk more about the history and other approaches that you've come across since?
One thing we came up against was there was a large world of people out there who said, this is not novel at all. We've known about this for a long time. And that community of people, I affectionately refer to them as fascia world. There are people who feel that the fascia is a neglected and extremely important, if not central, aspect of the way our bodies are organized. It includes osteopaths and osteopathic medicine, traditional osteopathic medicine, as it's been formulated in the last 100 years or so. But also people coming from different trainings like Rolfing and cranial sacral work, as well as people from a lot of different areas of what we might call integrative health, where they're working hand to tissue on living bodies and they have a sense of something here that isn't being captured by our contemporary Western ideas. And so there was a lot of anger in that community because they were like, we've been talking about this for 60 or 70 years. How could you say what you're doing is new? And I didn't know they were angry at first. um, uh, I was invited to do an interview that in fascia world, apparently everyone was waiting for the gloves to come off. And it was Robert Schleip, who arguably could be called the king of fascia. And he was going to moderate a discussion between me and Carla Stecco, who could be seen as the queen of fascia. And they thought this was going to be an argument. And instead, to me, it was fascinating because they were paying attention to this stuff. The reason I didn't know they were is because when you do literature searches in PubMed, this work doesn't show up,
Yeah.
not very easily. Most of where they published their work was in books, which do not show up on literature searches that I would do as an allopathic trained physician. And in allopathic medicine, we typically think of the fascia as being the musculoskeletal fascia, while these communities are thinking about connective tissue layers throughout the body. So there's a mismatch of culture here, allopathic versus all the other forms of medical health healing practices. And why are they publishing in books, not in the medical literature? Because they weren't allowed to publish in the medical literature. This stuff has been looked at as fringe. Um, and you even see it when we learn anatomy in medical school. What do? We're dissecting away the connective tissue and we throw it in a bucket without even considering what it's doing because we want to get to the organ, to the tissues that are important. And to some extent, this is a reflection of the fact that Western medicine and Western biology is actually defined on the basis of cell doctrine. When microscopes were invented, the first thing they saw were cells defined by cell walls in plants and cell membranes in animals. And prior to that, there had been an open debate philosophically, going back to the Greeks. Is the body made of indivisible subunits? They call them atoms. Or is it an endlessly divisible fluid continuum? And when we saw cell membranes forming a box, you can't chop a box into smaller pieces and get another box. You just get wall fragments. So cell doctrine was born. All living things are made of cells, and all living cells come from prior cells. Well, if that's how you're defining living things, then what about the stuff between the cells? There's no space in the definition for that. It's sort of pushed out. And so connective tissue in classical anatomy, it's just thrown away. So our work was helpful to that community, and they understood that I got it and that I heard them. And I've been collaborating with them ever since. Our subsequent work has been to show that in parallel, as they consider the fascia, the connective tissue layers of the body, to be a single network extending throughout the body, the spaces within that connective tissue, which is what we're seeing, that first work didn't really determine are there this kind of scale of interstitium within the liver and a separate one in the kidneys and a separate one in the GI tract, and they're discrete pockets that don't communicate. And all the work we've been doing since has been mapping this across tissues, between organs, confirming that it is in fact, as they suspected the fascia is, a continuous network through the body. And this interstitium and these fascial tissues are all intimately related. They're two halves of the same coin. Are you looking at the fluid component, or are you looking at the stiff collagen-based solid component? But they're intimately related everywhere you look. So that's kind of where my work is focusing on for this, because I'm an anatomic pathologist. Anatomy is the sort of thing I can do. I'm a liver pathologist. My main research areas are liver stem cells, and that got me into adult stem cell plasticity, which, is a very different thing. Liver cancer development, viral hepatitis, regression of scarring. So none of those things really went in this direction. This sort of came in from left field for me. But when you get an interesting problem and recognize it as one, you sort of have to go with it. So we published this in 2018, and I had an intuition that it might be related more broadly to some varieties of things. In particular, I was thinking of acupuncture at the time for a variety of reasons. But then we had this interaction with fascia world, and osteopathy and craniosacral work, etc. And completely independently, within that next year, I was in China doing consulting work for liver stuff, liver pathology things. We were creating something called the Beijing classification for regression of scarring and after viral hepatitis treatment. But since this had happened, they said, would you mind giving a talk on it? And so I gave a grand rounds. And one of the people who was invited, who I knew of because his Western specialty was liver disease. But it turned out he was also director of China's NIH for traditional Chinese medicine. And so, as such, he got the honor of asking me the first questions after my talk. And his first question was, so, what's been the response of people to this work in your world? And I said, well, there was a lot of anger at first amongst osteopaths and other, fascia world people, because they'd been talking about this kind of thing for 60 or 70 years. And he laughed and he said, yes, and we've been speaking about it for 4,000. Which was a really good moment, because I had been thinking that there's something. And what we've been finding is, well, if you look at who has cited our papers, about a fifth of them are cited by predominantly Chinese medicine journals, a few Tibetan medical references. And so there's a recognition that this anatomy is the concrete structure about which they've been describing using their metaphorical and intuitive languages. And when they see what we're talking about, they have sort of an instantaneous recognition. That's what we meant by this. And I've now been speaking to people from all sorts of traditions, including shamanic healing practices, Ayurvedic medicine, energy healing practices from Aboriginal communities in Australia, also in China. And they're all recognizing that some aspect of what they're doing and what they're perceiving in bodies and how they interact with bodies through their practices are related to this anatomic structure as this dynamic web throughout the entire body. I'm very careful about when scientific stuff starts getting used metaphorically, but there's an interesting way to me in which the functional anatomy, the structural anatomy of the interstitium turns out to be a kind of cultural interstitium that allows easy communication across cultural boundaries. That's one of the hopes I have for this work, is that can it help move us beyond Western practices to a truly global, integrative way of understanding what the human body can do and how we can perceive, register, and intervene and interact with other bodies.